Coming up on the FSR Sarc Fighter podcast, my first conversation with a doctor specializing in cutaneous sarcoidosis, or skin Sarc.
That's one of the things that I really wanted to focus on, that skin can be the first and sometimes only clue that sarcoidosis is present, because even as the granulomas of sarcoidosis are developing in internal organs, it might take a while for those granulomas to start to disrupt function or cause symptoms.
Joining me today on the podcast is Dr. Sotonye Imadojemu, who looks at sarcoidosis of the skin and also some of the unfortunate racism in dermatology.
Black Americans are more likely to have multi-organ sarcoidosis, and also more likely than other racial or ethnic groups to have skin involvement.
It's all coming up on the FSR Sarc Fighter podcast.
This is the Sarc Fighter podcast, living with sarcoidosis and other rare diseases. Here's your host, John Carlin.
Hello, this is episode 139 of the FSR Sarc Fighter podcast. I'm your host, John Carlin, as the introduction says. The date of this recording is May 21st, 2025, and this podcast, if everything goes according to plan, is scheduled to be released on Memorial Day here in the United States. That's the unofficial start to summer, certainly the beginning of what we call the travel season in the United States, mostly between Memorial Day and Labor Day. This is the first 3-day weekend of the warm weather season for most people. It's a great time to hit the open road, as it were, to take maybe a small vacation. Of course, a lot of people will add on to that one day off on Monday, and that'll be a family trip, maybe a spring break trip, something like that. But my family is planning on a camping retreat for this weekend. My son found some property on a small river. So you know what an Airbnb is, right? It's where you go and you rent somebody's house. Well, now people are putting their property out there, kind of like an Airbnb, only it's kind of rural acreage, and it's for camping sites. So there's no campground there per se. It's just a pretty field that's on a river. And so my two sons and their families and my wife and I will be going. They'll be staying in tents. And Mary and I expect at least one grandchild will be in my old 1993 Mini Winnie, which is a very small RV. And we will be roughing it, only so much. But I'm looking forward to some fishing, mostly introducing my grandkids to the outdoors a little bit more, maybe teaching them to fish maybe the next level of the fishing just off the dock, because there won't be a dock there, so we'll have to go down to the creek and kind of figure it out. And, they don't have a lot of patience at this age. So I will go in with limited expectations. But if I can sneak off by myself and see if I can't maybe land a big one when no one's looking, I will certainly take that opportunity to do that. But our old Mini Winnie has been in the shop for a good part of the winter. It runs. The refrigerator works. It's a place to sleep, and as far as I know, the roof keeps the rain out. It doesn't seem to have any leaks that I can find, and so we'll use that sort of as a base of operations. We'll lower the old-fashioned manual awning and put the chairs out underneath it, and we'll enjoy that. So, looking forward to getting the summer kicked off right. Of course, I want to remind you that I do the podcast to help you see hope at the end of the sarcoidosis tunnel. And I do it, I think, to give us all that sense of community. We need to let one another know that there are other Sarc patients out there. The 200,000 of us or so scattered around the United States, and at about that same density all around the world. And I'm always amazed when I hear from people in Europe and other countries, and recently had a guest on from New Zealand, and we've been staying in touch on email. So from Sarah. So it's just, it's really wonderful to have that sense of community, and I hope the podcast serves to help make that a more complete experience. But together we are all suffering the effects of sarcoidosis in one way or another. We all want answers, and in many cases we are finding them. And I want to let you know, this is a book recommendation to you. I like to listen to books that are based on history. You might call this historical fiction, but it's accurate to the extent that everything in the book is footnoted. It's all based upon diary entries and everything that is known about this particular shipwreck. All right, but the name of the book is called The Wager, and it's about a British man-of-war that gets shipwrecked while the crew is trying to sail around Cape Horn, around the southern tip of South America, which apparently is just notoriously bad in terms of the wind, the waves, the weather, all of it. And they wind up stranded on a remote, cold island off the coast of Chile. And the writer talks about the men's anxiety and also their hope, right? Because they're trying to figure out, what are we going to do next? We're here on this little island. They aren't being able to catch any fish. They aren't finding any food. There's no wildlife on the island. It's cold. They're miserable. But they had hope. And the author called hope the greatest intoxicant of them all, right? It's just when these guys thought they had no chance of getting to the next thing, no chance of surviving, no chance of being rescued, no chance of being found. Some of the wood from their wrecked ship started floating up on the shore, and so with great abandon they worked together, even though they had scurvy and a lot of them had died, and they were hungry, but they started putting together whatever they could to create a way to float off of the island with the meager means that they had around them, including some of the wood from the ship, and it was all driven by hope. It was all driven by hope. They had virtually no chance of succeeding, but what else were they going to do? And so right now in my present state, while I'm listening to the book, and I'm not comparing this to sarcoidosis right now. I'm not saying that all of us are shipwrecked on an island and freezing and hungry, but we're all facing an uncertain future in one way or another, and we all want to try and find a way past whatever sarcoidosis is causing in our lives. And so there is that greatest intoxicant of them all, and that would be hope. Right. So, and by the way, I'm only about 2/3 of the way through the book. I don't know what happens to the men. I just know that as of this point and I'm listening to the book on Audible in my car. I know only that that they are trying to get away from this island. All right. So anyway, and they have great hope. Here is a public service announcement that I want to pass along on behalf of the Foundation for Sarcoidosis Research. The Foundation for Sarcoidosis Research is inviting you to attend the 2025 Virtual Global Sarcoidosis Summit. It's called United for Progress, a new chapter in sarcoidosis. And you're invited to join FSR's biggest event of the year. It's June 28th and 29th. And you'll hear from world-renowned experts, you'll connect with others, and get your sarcoidosis questions answered. This 2-day virtual event will feature over 20 live and interactive virtual sessions to help empower patients, caregivers, and clinicians to work together to turn the page on sarcoidosis. And you can learn more and register now by visiting the FSR website, which is stopsarcoidosis.org/sarcoidosis-summit. That's a lot to remember, so I'll put a link in the show notes. I do want to put out there that registration closes on June 13th, and there are a limited number of scholarships available for people who might not be able to pay the entry fee. But if you can afford it, please do pay that fee, because there is a lot that goes into putting on this event, and it just helps offset the costs. And if there is anything that we wind up with afterwards, it'll either go towards in the kitty for next year's summit, or it'll be put towards additional research and services from FSR. So please hop on that pretty quickly. A link to register on the website and also in the show notes, or what some people would call the description of this show, which is typically found down below wherever you clicked on it. All right. As I mentioned in my last podcast, this is a great story. I'm just back from my cycling trip to the Netherlands and Belgium. And now that everything has settled a little bit, the high points are starting to rise to the surface, right? People kept saying, well, what was your favorite part? When I first got back, it was all my favorite part. I just loved it all. But there are certain stories that are starting to sort of percolate. And I want to tell you about our stop at Kinderdijk in the Netherlands. Kinderdijk is Dutch, but it's pretty close to German, but I believe it translates directly as child or children dike. And Kinderdijk is a UNESCO World Heritage Site, so it's preserved, and it was built around 1740, and there are still 19 windmills there, and they're a part of a larger water management system to prevent flooding in the Netherlands. And today they symbolize Dutch water management. And back in 1997, they became the UNESCO World Heritage Site. So there's the old-fashioned windmills, not like the big, pretty ones that you see. And when I talk about the big, pretty ones, you might disagree with me, but the ones that you tend to see today, the big white windmills that are used for generating power, right? Well, these are the old-fashioned Dutch windmills that were actually not used for generating power, and they weren't even used for crushing grain. They were used to pump water. And so I may have said this once before, but we heard it over and over while we were in the Netherlands. They say God created the world, but the Dutch created the Netherlands, because it's a very low-lying area at or below sea level. And so what they did is they had these windmills going back hundreds and hundreds of years, which were used to pump water into a series of canals, which it was almost like a lift lock type thing. If you've ever seen a boat lifted up so it can go around the rapids, the windmills would pump water higher and higher into a series of canals or reservoirs until that water level was above a nearby river, and then the water would be released into the river once it was above the level of the river, right? Because otherwise the river would flow in, but in this case, the reservoir would flow out, and then they would close some sort of a water gate, and they would pump more water back up, and so that's how they drained all these lowland areas, and the windmills were very important. Why am I talking about that? Well, as we were walking to the visitor center here at Kinderdijk, there was this kind of odd-looking sculpture in one of the bodies of water on a small footbridge we were walking over, and it showed a baby in a cradle, and there appeared to be a cat there next to the baby. And so we're walking in and didn't pay a whole lot of attention to it, and we didn't know the backstory at that point. But basically, what's going on there is there's a true story of back in the day when there was a flood, and a baby in a cradle floated out into one of these reservoirs or canals, and miraculously there was a cat with the baby, and the cat balanced the cradle so that the cradle wouldn't tip over, and they eventually saved the baby and the cat, right? And that is the origin of the story of the cats, of the expression, the cat's in the cradle. And it actually happened. And so I always think of the old song "Cats in the Cradle" and "Silver Spoon," "Little Boy Blue" and "The Man in the Moon." But the expression of "cats in the cradle" came from Kinderdijk, and that's why it's called Children's Dyke or Child Dyke. And so there you go. That's I just thought that was pretty interesting. So people are asking me, well, tell me something about your trip. For whatever reason, that didn't really hit me that hard when I heard it, but it keeps percolating up. So I thought I'd share that with you. Hope you find that interesting. And I'll go ahead and I'll put a link to the Kinderdijk website with the show notes as well. And if you're interested in reading more about it, I would encourage you to do that. All right, what kind of sarcoidosis do you have? Right, I've talked to a lot of different people who have different types of sarcoidosis. I've talked to a lot of researchers, a lot of doctors, but I have yet to have a dermatologist who specializes in sarcoidosis here on the podcast. And so coming up, Dr. Sotonye Imadojemu, who joined me recently, will share her insights on sarcoidosis of the skin.
I feel like a zombie, just feeding and stumbling.
Hi, I hope you're enjoying the Sarc Fighter podcast. You may be wondering, what can I do to help? How can I be a part of the sarcoidosis solution? It's simple. Make a donation to KISS, Kick In to Stop Sarcoidosis. 100% of the money goes to the Foundation for Sarcoidosis Research. Look for a link in the show notes of the Sarc Fighter podcast. Welcome back to the FSR Sarc Fighter podcast. And joining me now is Dr. Sotonye Imadojemu in Boston, who wears many hats. But most importantly today, we're going to be talking about cutaneous sarcoidosis, and also we're going to touch on race and racism when it comes to dermatology and sarcoidosis. So, Doctor, thank you so much for joining me here today on the podcast.
Thank you so much for having me, John. I'm happy to be here.
Tell us a little bit about your work there in Boston and the various. You've got so many things going on. It'd be easier just to let you say it than for me to read your very lengthy and impressive bio.
Well, I've been working as a dermatologist in Boston since 2017, and I developed a cutaneous sarcoidosis clinic that has been growing over the course of that time. I also do research and try to understand patterns of disease and sarcoidosis, especially as it relates to the skin involvement, and also trying to help dermatologists who may be the first person to diagnose a patient with sarcoidosis through a skin finding, understand what the appropriate workup can be to see if there is any other involvement of the sarcoidosis in internal organs, or and help refer those patients where they need to go. And then also a lot of my work and research is about trying to come up with treatments that are effective and targeted for patients with sarcoidosis. So between that and teaching the medical students and residents about the condition, I stay pretty busy.
I'll bet you do. So you're still doing research, but you're seeing patients as well. So you've got one foot in both buckets, as it were.
Yeah, that's what I love about academic medicine, and both influence one another. And I think it's a really nice combination of tasks and responsibilities that are complementary in many ways. And being in a referral center, I get to take care of patients from all over New England and sometimes all over the country, and get to see how their care has been different based off their geography or where they come from, and learn from my patients as well. We have medical students, residents, and fellows participating in the clinic, and bringing their curiosity and expertise to to bring to bear for patients too. So it's a really great, I think, clinic, and that crossover between clinical care and teaching and research. It makes my job so fun. I feel so honored to be able to do it.
Well, thank you, thank you for what you do. Now, cutaneous or skin sarc, that is sometimes it's a problem in and of itself, but sometimes it's more of a harbinger of things to come. Is that fair?
That's right. That's one of the things that I've really wanted to focus on, that skin can be the first and sometimes only clue that sarcoidosis is present, because even as the granulomas of sarcoidosis are developing in internal organs, it might take a while for that those granulomas to start to disrupt function or cause symptoms. But oftentimes when the granulomas of sarcoidosis are showing up in the skin, the patient or their doctor can see it. Even before that becomes symptomatic or causes a problem for them, they can see it, and that can prompt a further workup. So it's really important for patients to see a dermatologist who's curious, and a biopsy can be very helpful in establishing the diagnosis. And then, so a lot of my research and education to other dermatologists is about just that. What does sarcoidosis look like in the skin? What's the best way to test for it? What biopsy technique? And what are mimickers of sarcoidosis that we should make sure, like infection sometimes mimics sarcoidosis. So let's rule that out. And then when we feel comfortable with the diagnosis of sarcoid, what do we do next? But yeah, really important that dermatologists are really positioned to be early diagnosticians for this condition.
Yeah, does a sarcoidosis rash at a glance look any different than any other rash?
To the trained eye, yes.
Okay.
So cutaneous sarcoidosis is often called the great mimicker in dermatology. It has that tagline to it because it can look a lot of different ways. There's not just one sarcoidosis. The sort of joke is, if you've seen sarcoidosis once, you've seen it once. It can, and it's like that with other organs, and the skin is no exception. So it can mimic psoriasis, I would say, is for one of the more common dermatologic conditions. It can mimic psoriasis, but there are versions that, I mean, I don't want to scare anybody, making them look at themselves and say, oh my goodness, is this sarcoidosis or not? But honestly, it can look like a lipoma, it can look like a cyst, it can look like a skin cancer, it can look like a rash, it can cause hair loss, it can cause all sorts of things. So really what I often teach other dermatologists about the condition is to have what we call a low threshold to biopsy. And sometimes you feel like you haven't seen sarcoidosis, but it's seen you. It's kind of can be, mimic common things. So it is really helpful to be trained in the various ways that sarcoid can show up in the skin. And so I think it's helpful to have a specialty clinic, but literally any dermatologist can do it.
Well, what we hear a lot with sarcoidosis involvement in other parts of the body is the path to diagnosis for patients is always a difficult one, because doctors are not looking for this rare disease. And I don't blame it on the doctors. It's just, when you hear hoofbeats, don't think zebras, right?
Yeah, I think horses.
But horses, but sarcoidosis is a zebra. And so how do you get doctors to be thinking, well, it might be sarcoidosis, or that's something we ought to test for since it's easy?
Yeah, it's true. I mean, there are certain features of skin sarcoidosis that are more typical. So we talk about color. A lot of times, again, not always, but I'll speak in generalities. A lot of times skin sarcoidosis has a red, brown, yellow hue to it. And a lot of times it's a raised lesion. It's a bump. It's lifted off the surface of the skin. And if you run your hands over it and close your eyes, you'll feel a texture difference. You'll feel a bump. And it's often somewhat firm. So if you press on it, it doesn't have a lot, it's not squishy, it doesn't have a lot of give. So there's some features to it that might say, I wonder if I should be thinking about sarcoidosis here. And then there are some areas of the body where we see sarcoidosis show up a little bit more commonly, so that of the skin. So it's often head and neck. It can happen anywhere, but if you're starting to tick off boxes, red, brown, yellow hue, bump, firm, around, and it's on the head and neck, especially the central face, so nose, around the eyes, then you're starting to say, okay, I should be thinking about sarcoidosis. And biopsy is the key, and the skin biopsy features are this is exact same as you would get if you biopsy the lung or a lymph node. And so the other good thing about at least looking at the skin, if a question of sarcoidosis comes up either from symptoms or radiographic findings, say a chest x-ray was done and showed some features that might suggest sarcoid, I love to tell my pulmonology colleagues, my rheumatology colleagues, my neurology colleagues, whoever's seeing the patient, send them over to me. If I can find something on the skin, that's an easy, safe, straightforward, same day biopsy that can be done. The patient leaves with a little Band-Aid and we see the classic findings there. It sort of makes it that we don't need to do the more invasive, dangerous biopsy, potentially, risky biopsy. So that's another reason patients get sent to my clinic. But yeah, it's tough being, I don't want to say woe is me, but being a doctor is challenging. The more we know, the more complicated things get. But,
Right.
And then the last tip is if something isn't responding to treatment the way you would expect, maybe it's time to reevaluate the diagnosis and expand that list of possibilities and do that test, because it's not uncommon for us, the way we're trained as physicians is to minimize unnecessary tests, and if you feel pretty confident that you know what's going on, treat it. And I don't want to dissuade people from doing that. I think testing has some negative sides, like over testing is a negative as well. But then follow up with the patient. If it's not responding to the treatment, then take another look. That's
Got
kind of what
Is the rash, is it usually itchy or painful?
Usually it doesn't bother the patient at all. The
Mm.
only thing that bothers them is the appearance of it, especially if it's showing up on their face or their hands. It's someplace that the outside world will readily see and maybe ask questions about, or they become self-conscious about it. But luckily it doesn't usually cause symptoms.
Got it. And what's the probability then that they need a workup for an internal organ or something like that? If you see it on the skin, is that likely the first place in the body it's showing up, or could that be representing something that's already going on?
Such a great question, John. I would say, it's pretty common that the skin, when it's present, the skin can come first, or it can accompany internal organ sarcoidosis. So it's really important for dermatologists, once they establish the diagnosis of skin sarcoidosis, to do what we call an evaluation or a workup and say, okay, we have sarcoidosis in the skin, and we know sarcoidosis is a disease that can affect multiple organs. And what are the tests I need to do or need to order for my patient to get a good survey of the body and understand where other sarcoidosis may be hiding, because the patient doesn't feel anything yet, and this is the best time to catch it. So the standard sort of workup screening for internal organ sarcoidosis includes getting a good look at the chest, whether it's an x-ray or a CT scan, because pulmonary sarcoidosis is the most common organ to be affected, and getting an eye exam, looking at the back of the eye to make sure there's no ocular sarcoidosis, because as we know, that can cause vision loss. And then I've published on the importance of dermatologists to understand and evaluate for heart involvement, so cardiac sarcoidosis, because it can be really impactful for patients, especially if the sarcoidosis is involving the conduction system where the electrical signals are happening in the heart, and those arrhythmias can be very dangerous for patients and even lead to death. And so that is that's really important. And those are that, that's high level screening. There's also blood tests and things that should be done. Um, and so I just want to emphasize for patients who are listening, if you've just been diagnosed with a skin involvement, it'll be ask your dermatologist if they haven't already to either do some of that workup or refer you to somebody who can, because once you find the skin involvement, you're not done.
I know that one of the things that you've been working on is racial disparities in, I would assume, both diagnosis and treatment. Where are you seeing that? What would you want us to know about that?
Oh, great question. So in the United States, we know that Black Americans are more likely to have um, multi-organ sarcoidosis, and also more likely than other racial or ethnic groups to have skin involvement. Um, and and then finally tend to have disease that is harder to treat and diagnose later. So it ends up being kind of um, it's a puzzle to try and understand exactly what's going on there. Um, One of the things that I find interesting in understanding the pattern of disease involvement of sarcoidosis and skin sarcoidosis in particular is what are environmental risk factors or life experiences may be contributing to differences in disease severity and outcomes. And so one thing that I'm currently looking at is exposure to environmental toxins based off of where people live. And as we know, there's history, where people live has a historical basis, and some neighborhoods have higher proportions of Black Americans than others, and trying to understand, does that track with disease, disease incidents, like where the disease is showing up, and how that might relate to oil producing facilities and other environmental exposures. And some of it has to do with race, some of it has to do with class, some of it has to do with migration patterns. I think race is one aspect of it. But I think once we get a better understanding of the disease by focusing on a particular population, we can then take that knowledge and it can be helpful for the entire patient population with that condition. So having some understanding of a piece of it helps the whole. And so, yeah, that's how I think through understanding the connection between sarcoidosis and race and American history.
And do you think that perhaps the medical profession or all of us could somehow try harder to make it easier for Black Americans to get the treatment they need or to recognize that they need treatment?
Yeah, I think there's so many ways of approaching the problem, and John, I think that's an excellent component to it. We wonder whether some of the differences in severity at presentation to the health system may be a reflection of challenges in accessing healthcare rather than any different biological component of the disease. I think it's complicated, and teasing that out will be really important, because as we understand that, then we know what levers we can pull, which ones are going to give us the most bang for our buck, as resources are always limited and constrained. But yeah, I think that's definitely a question that I'm interested in, and I know others are. I kind of focus a little bit more on the understanding differences in exposures, but I think the understanding the healthcare access and systems piece is so important. I know there's researchers working on that, and that's something that patients can advocate for, of their health systems, of legislators, et cetera.
Sure. And I know you don't have a lot of time left today, and I do appreciate the time that you've given me here. But I didn't ask you about treatment for cutaneous. Is that prednisone just like everybody else, or is there another path?
Oh, I love this question, and I can take extra time for you, John, and your audience. Um, so I think cutaneous sarcoidosis is so fascinating because as as a condition that involves the skin, we have access to a lot more therapies, including topical therapies. So you can put uh, a cream of some sort directly on the skin, on the lesion, to try and make it smaller or go, even go away. We have the ability to inject medications right into the lesions if they're particularly bothersome or in a cosmetically sensitive area for the patient. And we use a lot of we borrow medications from other conditions that have we call it a mechanism of action, or like a way that it works that would impact why the sarcoidosis granulomas are developing in the first place. But what I'm really excited about is a trial that I'm an investigator, principal investigator for, on a medication that is targeted therapy, really based off of our understanding of the inflammation signals that are driving the formation of granulomas and targeting that. And a lot of the initial work to understand that inflammatory pathway has been done by dermatologists, and this study is for patients with cutaneous sarcoidosis, but they are tracking improvement of other organs, and so other organ involvement. So it's pretty exciting. We could have the first FDA-approved medication for cutaneous sarcoidosis, and potentially just the first in a long time for sarcoidosis more generally, coming down the pike in the next year or two.
Is there a name for this treatment, this medication?
Yeah, the medication's called brepocitinib. It's
Can you spell that for me?
well, now that I'm on the spot, let's see if I could do it. It's BREPOCITINIB, brepocitinib.
Okay. And which pharmaceutical company is working on that?
It's a small pharmaceutical company called Priovant, and
Okay.
they are particularly interested in conditions that aren't common. So, and that are really kind of orphan conditions or rare conditions that need medications that bigger pharmaceutical companies overlook because they feel like the juice isn't worth the squeeze. This is something that they've really have a heart about, and are doing a lot of great work with sarcoidosis and other rare inflammatory conditions.
So you're working on that in the lab, yes?
So actually, it's a phase 2 trial. So yeah, it's moved beyond the lab. Many patients have gotten it at phase 1, have gotten it phase 2, and for other conditions. So it's moving along.
So right now you've proven that it is safe. That's phase 1, right? Phase 2 is looking at how effective is it versus placebo, and is it effective at all? And
That's right.
have you finished enrollment for that?
Nope, it's still enrolling.
Okay, so somebody's listening right now. They're like, "Oh, that sounds interesting." And I've got Sarc, and I live in Utah. I don't live in Boston, where there's a hospital on every corner. How do people get involved with that?
So Private has a website that will let you know what clinics and hospitals are participating in the study, and they have sites all over the country. And so there, I'm thinking how far, you could go. I know there's sites in Philly, in Boston, in Phoenix. I think there are about 20 sites, so there's lots of coverage of the country. So check out Priovant's websites, Priovant.
Okay, well, that's awesome. I didn't realize that there was another drug out there that was showing that much promise. And most sarcoidosis drugs, if it works in one part of the body, it works in another as well, right? So this could be the cure or a treatment for somebody's cardiac or neurosarcoidosis also.
That's right. That's potentially, it would need to be, it's not the primary indication for this, outcome for this study, but I think absolutely you're right. A lot of the drugs for one organ have crossover effects for the positive crossover effects for the other. And so I think it could be really, really great. But for right now, the focus is skin, just because that's where a lot of the initial research has been done.
Yeah. So you're a relatively young researcher, but you're doing it at the highest levels. How optimistic are you that this or something that comes after it or both are going to be out there, say, in the next decade or so?
I'm very optimistic. I think attention to sarcoidosis as a condition has been increasing, and I think dermatology has been leading the pack on that. A lot of the current dermatologists who are focused on granulomatous diseases like sarcoidosis were trained by Misha Rosenbach at Penn, who's done a ton of work bringing cutaneous sarcoidosis and therefore sarcoidosis in general to light, figuring out how we can measure disease activity so then we can track it with treatment. These things are really foundational and they just take time. And I feel excited and honored to be part of this movement. I think that we are headed towards finding lots of great drugs for this mysterious, vexing condition.
It is so vexing. It is. That's a great word to describe it. It just is vexing. I like that. Is there anything else you'd want to add today?
I think I think that sarcoidosis of the skin isn't just skin disease. Can be an early manifestation of a larger condition. So letting patients know that if they are diagnosed with skin sarcoidosis, they're not done yet, really need that additional evaluation to look for other organ involvement, make sure they're getting that EKG to look for cardiac involvement, talking to their clinicians about any subtle symptoms that they may have been disregarding, and bring those to light in case any further workup needs to happen. And I think dermatology as a specialty kind of gets a bad rap of being focused on cosmetics and aesthetics, and I think the more that we can do to show a little bit that dermatology deals with real pathology, real disease, and can make a real impact on people's health is important as well. So if you didn't think a dermatologist was for you, just as a patient with sarcoidosis, just consider seeing one.
All right, great. And are you getting any funding from FSR?
No, not at the moment. I am on the scientific advisory board, but no, I don't get any funding currently.
Okay, well, maybe down the road, who knows?
Maybe. Right. I would be honored to do that. Yes, to have that.
Well, Doctor, thank you so much for joining me today.
My pleasure. Thank you for having me.
I feel like a zombie, just feeding and stumbling.
So thanks to Dr. Imadojemu for spending some time here on the podcast. I did have to record that one on my phone because of some technical difficulties with the computer and my my fancy little home microphone system here. So if the audio sounds a little different than normal, that is the reason. Please forgive anything technically that sounded off a little bit, but that's what happened. Please don't forget to join that FSR Summit that's coming up on June 28th and 29th. There's a link to register in the show notes. And this is a good time to contact me if you'd like to share your story on the podcast. Best to email me at carlinagency@gmail.com. The official Sarc Fighter song called Zombie is by Mark Steyer and his band The White Hot Lizards. The story behind the lyrics is episode 12. We got an update from Mark in episode 118. He's a fellow Sarc fighter. Podcast comes out every other Monday. As I'm speaking today, both my trusty dogs, Dougal and Shandy, are curled up here in my office. They make my life so much better. The backstory to the founding of the Foundation for Sarcoidosis Research is episode 11 with Andrea and Redding Wilson. Follow the show on social media, Facebook, Instagram. I'm even on Peloton as Sarc Fighter. If you have a Peloton bike or treadmill or rower at home, my cycling blog, Carlin the Cyclist, has a section called Cycling with Sarcoidosis. If you're new here and you're just trying to figure out what sarcoidosis is, listen to episode 2 with Dr. Simon Hart of the UK. My story is episode 1. Again, please send me an email. It's in the show notes, carlinagency@gmail.com. Until next time, keep fighting.
Learn to suffer, you feel pain someday. Learn endurance, your strength will fade away. Dead man walking, trying to keep up the pace. Dead man walking, counting